Okay, so now I'm going to tell you what happened after the birth. Again, the birth went very well. We were at home and we stayed at home for 3 days. Unfortunately, every day that would pass, I was more and more dizzy when I would try and sit up or get out of bed. And over those 3 days, I ended up passing out 3 times. Once with a midwife there, and then twice with just my husband there. So it was pretty scary. It was scary for him and trying to take care of me and the baby at the same time. So by the third day, we talked to the midwife, and she consulted with her OB that she works with, and they said, let's not take any chances. Call 911. I mean, it's not an emergency to go right now to the hospital, but call 911 so that they can come there and check you out at home, and then if they feel you need to go to the hospital, you'll go. So we had a little adventure. This was, I think it was Friday. Yeah, Friday afternoon. We called the 911. The EMTs came. They checked all my vitals. They did EKG to check my heart because I have mitral valve prolapse, and we didn't know if it was something to do with that. Everything was fine with my heart. Blood pressure was low, but it's usually low. Glucose was fine, but when I would try and stand up, I would get really dizzy. So they said, okay, we're gonna take you to the hospital. So ended up spending 24 hours in the ER, which was horrible because I was very dizzy when I would try and get up. So I was in bed, in the emergency room. So you're just in this little curtained off section. That was not fun at all. I needed to use a bedpan. And everyone's rushing around. You never know who's going to be next to you. So you've got people yelling and cursing. And it was very hard. Plus, I couldn't have the baby in there because there's all these sick people there. So I ended up getting a breast pump after asking many, many times, and pumped the milk, and then my husband came and got it once. He had a friend stay with the baby, and he came and he got it. But then the next time I pumped, he couldn't come. It was 2:00 in the morning. So it was, I had this nurse that really helped me to keep calling back the maternity floor and say, look, we have someone in the yard. She needs to freeze her milk until the morning. And so finally we got it up there, and then when my husband came, they went and got the milk for him. But it was not fun. I didn't want to be separated from my baby and my husband, and of course I didn't want to be there. But in the meantime, they're doing all these tests. They did an ultrasound and saw I had some fluid in my uterus, which was probably just the blood, but they did x-rays, they did blood cultures, urine cultures, all this stuff, and they found out by the next day that I had an infection in my endometrium, so endometritis, or inflammation of the endometrium. Not endometriosis, but endometritis. This is something that can happen after birth, but it's not associated with how I birthed. It's just something that can happen because your body's defenses are low from the hard work that you did in labor. And so all your defenses are low, your immune system is weakened, and so women can get this infection. So what the doctor called it, he said I went into septic shock, which is just the body is shocked because it's fighting an infection. It decreases your iron, your white blood cells go way up. um, your blood pressure goes down. So that's why I was so weak. So on Saturday I was able to get a room in the mother and baby floor, so like a postpartum floor. So that was such a relief, just to be able to go up there, have some peace and quiet, have my own space. And then for the next 4 nights, that was Saturday, Sunday, Monday, and then Tuesday I ended up going home. So those 3 nights, my husband and the baby came and slept with me in my room. And it was very hard because I was in a lot of pain from the stitches, and still dizzy, but every day was a little better. I could get up and use the restroom by myself. And this whole time I was having IV antibiotics and IV iron and fluids. But every day I kept getting better. So it was not fun, but I'm so glad that the hospital and the doctors were there when I needed them. And it was really a huge lesson for me and for whoever I'm going to share this with, because I had I had a perfect pregnancy. Everything was very low risk. Everything was fine. And the labor and birth were fine. She came out, the baby's so healthy. Nothing is wrong. It was in my own home, very peaceful. That's how I needed it. I would not do very well giving birth in a hospital. So that's what I needed, is to be at home. And it was totally no risk, or low risk. So that home birth was exactly right for me and my baby. And then I'm the one who developed this problem, this infection, and the doctors were there when I needed them. The hospital was there when I needed them. So I'm very thankful, but it also reinforces for me how important it is to use the doctors in the hospital for what they're good at, which is taking care of sick people or doing surgeries. It's not the place to have a healthy baby with a low risk pregnancy. So it was very interesting, this whole experience. Now it's been a couple of weeks and I'm finally feeling normal. I've had my mother come and stay with me. I had a doula right after I got out of the hospital because my mother wasn't here yet. And my husband was really doing everything. So he was able to go back to work for a bit. And so I went home that Tuesday. I had a prescription for antibiotics for a week, and I've also been taking iron. So it is now the following Friday. So this past Tuesday I stopped taking antibiotics. I'm still taking iron, taking lots of supplements. I'm taking my placenta supplements. I just started those today. And also probiotics to help replenish the good bacteria in my gut. I'm also giving some of the probiotic powder to the baby to help her immune system as well. And I guess that's about it. This was a very interesting, humbling experience. We had a lot of help from friends and family who came by, which was so important. And like I said, my mother is still here visiting from Oregon. She's going to go home on next Tuesday. And I really, really needed her. I think that's about it. It's a lot of information. If anyone has any questions, I would be happy to answer them. But now everything's good. I'm very happy. I've got my husband on the couch taking a nap with the baby, and everything's good. So I'll talk to you later. Bye.